The number of COVID-19 deaths and hospitalizations continue to decline across the country, but data shows new cases remain high. According to Johns Hopkins University, there have been, on average, 72,000 new cases each day over the past week. Correspondent Mark Irons reports. Mark?
Tracy, let's start with those good numbers. After more than a month of declining cases and hospitalizations, the COVID-19 death rate is expected to continue to slow down in coming weeks, but there are still concerns about the impact of new strains of the virus.
Scientists estimate that the B.1.1.7 variant will be the predominant form of the virus in the United States by mid to late March.
That's the highly contagious variant first identified in the UK, now identified in at least 45 states. But other variants are concerning too. Scientists are keeping their eyes on one in California and another found in New York City and other parts of the Northeast.
The scary thing about this new variant is not only does it look like it could potentially be easier to spread, but it looks like the new variant has also adapted ways in order to kind of evade our immune system.
To address the growing threat, the CDC is teaming up with public and private labs to better identify the variants, and vaccinations will help.
We need to ramp up our vaccination efforts. If we get everyone vaccinated, we will be protected. The vaccines are going to protect against the new variants. They may not protect as well, but they still will help overall.
A report from the University of Washington's Institute for Health Metrics and Evaluation shows signs of hope. It says case and death tolls have dropped 70% over the past 5 weeks in the U.S. The report attributes that to multiple factors, including vaccinations and the widespread use of masks. And according to new data today, the 2 vaccines available in the U.S. from Pfizer and Moderna are as safe in the real world as they were in clinical trials.
Systemic and local reactions are most commonly reported to VAERS. Anaphylaxis does occur, though rarely, and there's no safety signals for any serious adverse events.
Today, the FDA is looking to give emergency approval to another vaccine here in the U.S., this one from Johnson & Johnson. But pro-life groups say it was produced using abortion-derived cell lines, and the other 2 vaccine options here in the U.S. from Pfizer and Moderna would be more ethical options. In the studio, Mark Irons, EWTN News Nightly.